I don't think and I don't mean to cut you off, I don't think the mainstream media and society as a whole really understands the impact that alopecia areata, universalis, and totalis has on people. You know, it could be a ticking time bomb for anybody. Anyone, it could affect anyone at any time. It's not just children who are being born with this disease. And I have known people have contacted us through the American Hair Loss Association who are 45 years old. They didn't have, common androgenetic alopecia, and then all of a sudden they lost half their head of hair overnight, and they don't even know where to turn. And sadly, the treatments, while there are a few treatments that seem to be quasi-effective, maybe in the short term, in many instances, the treatment itself can be worse than the cure, so to speak. And a lot of people spend a lot of time. There's a lot of heartache, and even out of pocket, money out of pocket to try to treat their children, try to treat themselves. In the end, they usually lose the battle. This is the first time in history that this type of alopecia has ever been successfully treated. And you did it with a medication that's already FDA approved.
Right.
Tell me how that happened.
So, my patient was referred, before he was my patient, was referred to me for the treatment of his psoriasis.
Right.
And I walk into the exam room, and indeed he has psoriasis, but the first thing you notice is absent eyebrows, absent eyelashes.
And most people they don't even know. They think people think of hair loss as just your typical androgenetic alopecia, typical male pattern baldness. But when people see somebody with alopecia universalis, it can be shocking. And then imagine this kid having to walk through life, not only dealing with that, but this insane amount of plaque psoriasis all over his scalp.
Right.
I mean,
no. To add insult to injury, you wipe away the hair, and now you place prominently on the scalp, extending to the forehead, red scaly plaques, out of which grow hair. So
right.
The only hair that is growing is from red scaly plaques, and it's really it's tough. It really is tough. And the psoriasis aside, as you point out, much of what you see, and you don't think of this when you look in the mirror every day, but your eyebrows and your eyelashes, they figure in to your self-image. You may not think of it. And if somebody were to have you draw yourself, guaranteed you would draw eyebrows and eyelashes. You may not think of it, but it is a prominent part of the way you see yourself.
That's right.
And so he's sitting there. I notice that he has alopecia universalis, and I say, are you certainly you're aware of that? Oh, yes, I am. I had alopecia areata starting when I was 2, and Spencer, as you point out, kind of went through life, from day to day, week to week, not knowing was he going to wake up one day or the next with another patch of hair loss,
right.
Here or there, and then at the age of 18, he loses all of his hair, so he transitions to alopecia universalis, develops psoriasis. I don't
mean to cut you off, but did he discuss what his life was like? Because you must have, since you were treating him for a while, he must have opened up to you to some degree what it was like having to deal with life with, such a devastating disfigurement. And I don't care what anybody says. When people say man up, it's just your hair. I deal with mostly men who are dealing with androgenetic alopecia, and some of these guys are suicidal. I can't even imagine what it must be like, not only for a young child, but, at the age of 18, when you're just starting out in life, to all of a sudden lose every hair in your body. You have to be a strong person to get through that.
and my patient is the strongest of all, and he, I think probably very early on he learned that he just needed to persevere and get through it, and so he was relatively, again, he had, I think at some point he stopped asking if there was something that could be done, because as all of these patients understand, in very short time, there is nothing that can be done.
Right.
And so after a lifetime of it, you stop asking the question, and so I said, but so in any case, I looked at him, and I thought, but wait a second, we might have an opportunity here. Why would I just undertake to treat your psoriasis? And there are several good psoriasis medications on the market now. But I thought, why would I try to do that alone if I can bring a medicine to bear on both problems?
Well, let's talk about that connection. I think it's important for people to understand, how you were able to make that connection.
Well, the connection was made. My practice as a dermatologist really kind of focuses on folks with refractory, often uncommon and refractory skin disease, and so by necessity, I need to draw on tools from other parts of medicine to bring to bear on solutions for my patients. And with that in mind, I was aware of two things. So this was a very interesting confluence of, or a very kind of fun confluence of events. So here I had a patient with plaque psoriasis. I had a patient with alopecia universalis. I was aware of research from Angela Christiano's lab,
who was actually
at Columbia, who you've had on your show before.
She was actually the first person, my first guest back in 1998 when I was on WABC radio. So yeah, she's been in the trenches for a very long time.
Oh no, it's really important to understand that Angela Christiano has done just an enormous amount of work to help us understand.
It's amazing
what is happening in this spectrum of diseases, and being aware. So again, I have a patient with psoriasis, a patient with alopecia universalis. I am kind of vaguely aware of some results from Dr. Christiano's lab showing that the mechanism underlying this spectrum of diseases relies on CD8 T lymphocytes and IL-15 signaling, and that she has or had given tofacitinib, this medication, again, borrowed from rheumatology for the treatment of rheumatoid arthritis. She had treated mice with alopecia areata with this medication, and they'd regrown hair. And so I had an FDA approved recently, just 2012, recently FDA approved drug. I had knowledge of Angela Christiano's results in mice, and I had a patient with plaque psoriasis and alopecia universalis, and the plaque psoriasis gave me an opportunity to prescribe this medication, because this tofacitinib has been through several clinical trials, most recently, as of I think early this year, showing that it has some efficacy in the treatment of psoriasis, and so so I thought to myself, well, why don't I try to argue to his insurance company to treat his psoriasis with tofacitinib in the hopes that I could actually treat both of his problems at once.
Right.
And that was the idea that happened, in those kind of 5 minutes in the room with him the moment we met.
But I mean, just that, revelation, just that thought process has completely changed this young guy's life.
Yes.
And, I know that it's only one patient. Everyone is like cautiously optimistic. How, are we going to be able to reproduce this? Or are you going to be able to reproduce this in other patients? But I mean, theoretically, there's really no reason why you wouldn't, especially if, I guess it's thought that alopecia totalis, universalis, and areata basically work in the same way or have the same mechanism in everybody. So
Correct.
It's not like there's varying mechanisms. So there's no reason why, if you were able to treat this guy successfully, that we couldn't do this across the board. I think the big question is going to be the potential for adverse side effects from the drug, and how is that going to kind of play into the model?
So, I think the question very naturally arises, will this be become treatment for this whole spectrum of diseases? It's super important to emphasize, this was not luck. This was by design.
Right.
I did not give this patient of mine tofacitinib, in the hopes that I would treat his psoriasis, and it happened. This is by design.
I have to tell you, just listening to it,
science
just listening to it gives me
it.
goosebumps, because it's such an exciting breakthrough. It's such an exciting event in the world of hair loss. And I just don't think, I saw the way the mainstream media covered it, and it's just so lackluster. It's okay. This is just the way that, that it has to be covered in the news. I just don't think they understand the impact that this is going to have on so many millions of lives.
That is right. That is right. It is this result is going to be reproduced. This finding is going to change the game for folks with this spectrum of disease. And getting back to your earlier point about side effects, absolutely. Every time you put a pill inside your body, you have to be cautious and considerate.
Look, I've been on finasteride for over 20 years. There are people who are so scared of the drug they won't even touch it. But in my case, it's been extremely beneficial, and I've had no adverse side effects, at least that I'm aware of.
Right.
So
right.
You have to be willing to take the risk, I guess.
Right, for sure. But it raises an interesting consideration, and that is not everybody would need a pill.
Right.
If you have alopecia universalis, then I think you probably would want to take a pill. But let's imagine now that we can formulate this medication as a cream, as a topical therapy. Again, if you have 10 spots of hair loss throughout your scalp, it would be very possible that you could simply put a liquid solution in your scalp every day to regrow and to maintain that hair regrowth. You may not need a pill.
Right.
And so really the next step needs to be formulation and testing of topical delivery of this medication, because all of a sudden the question of side effects, while they don't go away, they certainly become much less dramatic.
Right. Right. Well, you're not getting as much of the drug into your system systemically.
That's right.
Yeah.
That's right.
This pill, I mean, I've never seen regrowth like this kid had. I mean, this guy now has a completely full head of hair. Not to mention, from what I'm reading, his eyebrows, his eyelashes, his body hair is all grown back. Now, do you think that this I mean, I'm sure one concern may be that how long would this last? Will the hair continue to cycle normally as long as he's on this medication? And is it something that will eventually, will he become resistant to the medication eventually?
I don't think there is good reason to imagine that that would be the case. It is really what is at play in the mechanism underlying these disorders is this interleukin 15 mediated recruitment of immune cells to the hair follicle, which subsequently, basically kind of dissolve the hair follicle, and there's no clear reason to think that this is a medicine that you would become immune to at some point.
Right. Well, but as far as side effects are concerned, I mean, and I guess, you're new to this as well. I mean, I guess it's possible if people are suffering with significant adverse side effects that maybe even intermittent therapy may be something where people can cycle on and cycle off.
Spencer, I don't think that I think that to say that somebody needs to be on this medication day after day, week after week, month after month, in order for this effect to occur. Again, I cannot say that that's not the case, but it may very well be. In the same way, right? In the same way that we treat people with alopecia areata, somebody comes in with 3 or 4 spots of hair loss, we inject with steroid,
Right.
and they go on their merry way, and they're fine for 6 months or 10 months before another spot emerges.
Right.
It may very well be that somebody can take this medication for a month, 2 months, and be on their merry way, and that you could imagine tailoring regimens to individuals. You know that this person is going to need 1 month every 6 months.
Yeah.
It may just be that they need 1 5-milligram tablet every 3 days. Again, until that data is available, we're not going to have that answer. But I think that this result is really hopeful. It is really hopeful, and it will be duplicated. The question is only going to be, what are the parameters that need to be kind of obeyed for 50 patients on the whole. Is it going to be what will be the dosing regimen necessary
Right.
for this condition?
Well, the truth is it's FDA approved. There are going to be dermatologists out there who are going to obviously find out about this finding, and the drug will probably be prescribed off-label to the people who are very desperate to give it a shot. I mean, I don't know, how comfortable doctors are going to be prescribing this drug at this point. But the truth is, when this news came out, we were bombarded through the American Hair Loss Association, through the International Alliance of Hair Restoration Surgeons, and through the Bald Truth. I mean, the email boxes were just completely full. And that's why I reached out to you guys so quickly. I was actually, I woke up even before I saw the news, and I'm like, I couldn't believe the amount of email that we had. So there are people who are going to be scrambling to get their hands on this drug. There's thought to be an inflammatory effect with male pattern baldness as well, besides a DHT connection. Do you think that this drug may help with common androgenetic alopecia, male and female pattern hair loss?
So the way I think about that is while, again, it goes back to, this specific patient, and I very specifically gave him this medication because I knew what the science had told us.
Right.
So getting around to that question of male pattern baldness or female pattern baldness and whether or not this might affect that condition, while I would not hazard a guess yet as to whether or not tofacitinib will will sufficiently or successfully treat that condition, it gets back to an earlier point where if we can show that we can deliver this medication to the hair follicle in a topical formulation, what would keep us and that topical formulation was useful for the treatment of alopecia universalis or alopecia areata, what would keep us from trying it in male pattern baldness? So that the ability to try that, I don't think is, well, I hope anyways, is not far away. And I think that these findings will hopefully kind of spur increasing interest in this problem and increasing interest in this pathway, and maybe we will find that there are connections.
Well,
common connections.
The truth is, and I think that's amazing, and that's amazing news for people with common androgenetic alopecia, but there is this whole kind of gray market movement online, and there are thousands of guys and women who have been experimenting with different medications. My fear is that they're going to get their hands on this drug. I don't want to name the brand name. I don't want to give them, make it easier for them. But they're going to get their hands on this drug, and there's going to be young guys who are going to start, buying it from, different online pharmacies. And I just want to make sure that, right now we don't know if there's a connection. So I don't want these kids to start popping these pills.
Well, no. That is everybody has to understand that this is the beginning. It's hopeful. It's beyond hopeful, but we have to be patient. We have to be patient. I don't think that these opportunities are necessarily even that far away, but we have to be patient, and we have to move through this, cautiously and safely, and absolutely nobody should be experimenting. Nobody should be experimenting on their own. The medication is a potentially potent medication, and should never be purchased on the black market. It really these results are hopeful. They're just interesting. They're going to change the lives of countless people, but there is data that is not far away, and we just have to patiently wait for that data to emerge.
Well, let me ask you about a timeline. What do you think the potential timeline for a topical treatment to be put on the market? I mean, the drug is already approved for one application, and it's approved orally, so it shouldn't take that long to push through if you guys kind of get the green light to move forward.
I am encouraged by your words, and I am trying diligently, and have been trying diligently to get a topical formulation to use in folks with alopecia areata and Totalis and Universalis.
Well, if the drug company needs
it's possible. It may take some clever science to make it happen. It's a big molecule, and delivering it across the skin may be tricky. But again, if resources and interest is brought to bear on the problem, I think everything is possible. Just as I think, we're now seeing for the first time that this is possible, something that 10 years ago we would not have thought could be done. I think that the next steps are small in comparison.